Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Today's presenter is Marissa Domingo. Marissa graduated from San Jose State University in 2008 with a bachelor's degree in nursing. While at San Jose State, Marissa performed her clinical rotation at Washington Hospital on the 5 West floor, as well as her senior preceptorship at the Center for Joint Replacement. Marissa now works at Washington Hospital on the 3 West floor.
Hi, good evening, everybody. My name is Marissa Domingo. I'm one of the nurses here at Washington Hospital. I've been working here for about 5 years. I entered here on the new grad program, so I started out my new nursing career here in Washington. It's been a pleasure to be a part of the Washington Hospital family, and I'm really honored to have this opportunity to be able to share about PCOS, or Polycystic Ovarian Syndrome, with you all. I know that most of you out here in the audience are males, but I'm sure that somewhere you know a female or have seen a female, and hopefully that maybe you could help educate them as well. So what is PCOS? PCOS stands for Polycystic Ovarian Syndrome. It's a complex hormone disorder or imbalance of the hormones that are in the brain and ovaries. So in the picture that I have right here, the normal ovary doesn't have any cysts. There's tiny and in the PCOS ovary, there's tiny cysts that form within the ovaries when the hormone imbalance interrupts the ovulation process. With PCOS, it doesn't hurt or anything to the woman, and so it's not harmful, and so there's no surgical intervention that may need to be done. I actually have PCOS myself. I was diagnosed about a year ago, and I had no idea because I didn't feel any pain. I was just talking to my doctor and going through a few other steps that she was able to let me know about that. So a lot of times it goes undiagnosed right away because you won't know the symptoms. So who is at risk for PCOS? PCOS is actually a common problem among teen girls and young women, although it can affect women of all ages and ethnic groups. It's primarily targeted towards the teens and the young women because they are running around a lot, and women these days and children, they go under a lot of stress. We're always busy running around, and stress can actually throw off a lot of our hormones, and we have no idea. So how PCOS is diagnosed. To diagnose PCOS, the presence of 2 of the following 3 criteria must be present. Criteria number 1 is the clinical evidence of androgen excess, which is the testosterone. 2 is an ovulatory dysfunction. And 3 is the polycystic ovaries on a diagnostic imaging, such as an ultrasound. Ultrasounds don't hurt. It's kind of like when the women who are pregnant, they go and see the doctors. It's just a nice little gel, goes right over the tummy, and you can see it that way. So symptoms of PCOS. The clinical signs are you have chronically irregular menstrual cycles, or actually an absence of periods. People who have PCOS may have a difficulty conceiving or may actually have infertility. Common symptom is also obesity, weight gain, and difficulty losing weight. There's also acne or an excessive hair growth also called hirsutism. There can be also male pattern hair loss or actually thinning hair. Type 2 diabetes or insulin resistance is actually common as well, which is why the topic is being discussed today, because it's actually related. And there are patches of dark skin that can be noticed on those with PCOS. The scientific name is Acanthosis nigricans. So there's actually currently no treatment for PCOS. The way that PCOS is actually treated is actually by managing the symptoms. The big ways to do that is to correct the hormone imbalance by regulating menstrual periods, and also to lower testosterone levels. The other big way, similar to with diabetes, is weight management and lifestyle modification through proper nutrition and exercise. So PCOS is actually a hormone-driven syndrome. The big players here are the brain, the ovaries, as well as the pancreas. So the brain secretes a hormone, LH and FSH, which is luteinizing hormone and follicle-stimulating hormone. It comes from the pituitary gland in the brain. When that is secreted, it goes down to the ovaries and tells your ovaries to secrete estrogen and progesterone. What that does, it helps prepare the body for this menstruational cycle, or possibly if the egg is fertilized, pregnancy. The ovaries also secrete little bits of testosterone. So women and men actually secrete both of the male and female hormones. So males, they actually also secrete a little bit of estrogen as well. Another big key player here is insulin, which comes from the pancreas, and that helps to regulate the blood sugar levels that we have. So the regular menstruational cycle is about 28 days. The first day is when you actually see the blood and you count it from there. So as I mentioned earlier, the brain secretes the LH and FSH to the ovaries, and when that happens to the ovaries, it tells the ovary that you want to go ahead and ovulate and send out the egg. So when the egg goes ahead and travels down the fallopian tube, the progesterone from the ovary helps the uterus to thicken. By having the uterus thicken, that helps create an environment that will support the egg throughout the pregnancy. So if the woman is pregnant, it will stay there. However, if the woman is not pregnant, all of the thickening of that lining of the uterus is shed out, and that's what you see as the menstruational cycle. And then after the shedding happens, you go ahead and go through your menstruation again. What I wanted to point out here is the picture on the left is showing the menstruational cycle. You'll notice that there's a spike right there halfway in the middle. So by day 14, halfway through your menstrual cycle, the surge of the luteinizing hormone, or LH, is what helps indicate the follicle to actually release the egg. So in the PCOS menstruational cycle, or the picture now on the top, you'll notice that there's actually no spike in the hormone levels. So pretty much, since there is no surge of the LH, the follicle will not actually know when to release an egg. So that's how you can notice that there may be either absences in periods, or actually there can be a long gap in between having menstruational cycles. So that's yeah, so for some people, for example, for me, I would actually go a long time without getting my menstruational cycle, and I had no idea until I actually looked through this and actually realized that with my levels, I wasn't getting it as well. So a way to help with those who have irregular periods is to do something that we call period tracking. What that does is just helps the women keep track of, like, for example, the length of their cycles, how much flow there is, because we don't always bleed at the same time, and sometimes signs and symptoms. You may notice, like, your wives or your daughters going through all these different stages where they just aren't that nice, or they're crying all the time, or they want something sweet or something salty. They may complain that they're bloating and their chest hurts and everything else. That's all important because that's all kind of driven by the hormones. The hormones kind of dictate how we are. There are many apps out there that are free that help help the women keep track of their cycles. This is important for the healthcare provider because this may help see if there's any types of patterns. For some people, they may not have menstruational cycles every month, but they may have it actually every 2 months, every 3 months, or maybe no pattern at all. One of the ways that we can help regulate the hormones is through the oral contraceptive pill or the birth control pill. It helps with the regulation of menstrual periods. On the left are a lot of positives, so the pros of taking the oral contraceptives. For example, having regular periods, lighter periods. People with PCOS tend to have a little bit of extra hair, and that will help get rid of that. They'll actually have less acne, maybe even no signs of cramping. And it can also decrease the chance of endometrial cancer, ovarian cancer, and ovarian cysts. Things to look out for when you're on the pill are sometimes spotting. They may still have like sore breasts or actually weight gain. A lot of women don't like to try to take the birth control pill because they believe that they'll keep getting big. That's not necessarily the case. They can either gain or lose. Another thing that I'd like to point out is that when they're on the pill, they need to watch out because one of the signs that could cause something worse are blood clots. So if they're smoking or anything like that, that also increases the risk for those blood clots to go around. And I've seen those in the hospital. They're kind of very much something you don't want to worry about. So when taking the oral contraceptives or birth control pills, there are so many different kinds out there. They come in circles, they come in packs of 21, 28. Who knows what you can pick out there? When you talk to your doctor about this, they'll help set you up with the right one that's for you. When you do take the birth control pills or oral contraceptives, you want to make sure that you actually take them as directed and on the packaging. You want to take them 1 pill at a time every day around roughly the same time. So sometimes for women, they'll go ahead and set alarm clocks, or some of these trackers will actually have like a little reminder for you. And you want to typically take the pill on the first day of your menstrual cycle. So the first day that you're actually seeing the blood. You want to continue to take these pills day by day, one by one, every day until the pack is done. If you happen to miss 2, you want to go ahead and stop. Make sure you use another form of protection and then restart again as soon as your period has come. So the other hormone that we are dealing with other than regulating your menstrual cycle is actually the testosterone levels, the androgen testosterones. They tend to be a little bit higher in the women. So one of the ways that doctors like to go ahead and counteract this is by actually prescribing a medication called spironolactone or aldactone. We normally commonly hear about this medication because it's mostly given to those who have high blood pressure or swelling. So that's called edema. You can get them in your hands and feet. So with this diuretic or the water pill, what it does is it will eventually, another way is it helps decrease the androgen levels in the body. So then you'll actually have a little bit of the clear skin with no acne as well as less body hair. Some of the other side effects of taking aldactone is you can have actually irregular periods if you're not on the birth control. And because it's a diuretic, you should anticipate that you'll be having frequent urination. So you might want to take this more so in the morning while you're awake so that you're not getting up in the middle of the night going to the bathroom. An important thing that I did want to point out is with spironolactone, you don't want to take any type of potassium supplements while on this medication. What spironolactone does, as well as being a diuretic, it actually helps, it's called potassium sparing, or it helps keep some of the potassium within the body. If you end up having too much of the potassium within your body, you may put yourself at risk for cardiac arrhythmias, which can take you to the emergency room. You are still okay to take multivitamins, and you can still have your bananas, and you can still eat. You just don't want to take too much of it. And so I wanted to also talk about PCOS and insulin. With PCOS, there's actually too much glucose and insulin going around the body. Having the high levels can cause one of the outward symptoms is you can see dark patches across the neck, the underarms, as well as the upper thighs closer towards the groin. It actually can go away a little bit and fade. So with the insulin actually being utilized properly. So if you're actually on this route and if you aren't treated or not actually trying to manage the sugar levels that you have, you can actually lead to full-on diabetes. So insulin is actually a hormone that's secreted by the pancreas, and it helps the glucose go from the bloodstream into your cells so that you can use them as energy. It's commonly, you'll see commonly the lock and key method to help explain glucose and sugar levels. The way that it works is that the insulin acts as a key, opens up the pathways so that the sugar can go inside. Sometimes with those who have the insulin resistance, the key doesn't really work very well, so that it's almost as if you were trying to go to your neighbor's house and trying to use your front door key into theirs, and it wouldn't work. So we need to make sure that it's the right key and the right lock to be able to utilize all the energy. So those who are at risk for insulin resistance, again, are those who can be overweight, they're obese, and sometimes through genetics. A lot of us, we come from different ethnic backgrounds where we tend to eat a whole lot of different foods that may focus on like rice and carbohydrates and pastas and breads, things like that, which help rise all of the blood sugar levels. Again, I just wanted to reiterate that the name of the brown patches that you can see is acanthosis nigricans, and that the increased insulin resistance, if left untreated, can lead to full-blown diabetes. So when you're testing your own glucose levels, if you test it before the meal would be the accurate one. And according to the ADA, before the meal you would want 80 to 130 milligrams per deciliter for your blood sugar levels to be within a good range. Or if you check after you eat 2 hours, you want it to be less than 180. We don't check our blood sugars right after we eat because we still have to allow the time for the food to go ahead and break down so that you can get a more accurate result. So to help with the sugar levels that we have, doctors may prescribe for those who have PCOS metformin, or it's also called glucophage. What this does, it helps regulate the amount of glucose in the blood. It works by making the body more sensitive to the insulin that you do have, so that, as well as decreasing the amount of glucose that your liver makes. Typically our livers already make a little bit of glucose for us to help us keep going. As I was mentioning earlier with the lock and key thing, by taking the metformin, it helps kind of as if you just found the right key to the door. An important thing to note about when you're taking metformin or glucophage is that you want to stop taking it 48 hours, so 2 days before and after you take any tests that require a contrast material. The reason behind that is because it can be a little bit harmful to your kidneys, and you don't want to go into any type of kidney failures with that. So make sure that you ask them. If not, if the tests are really necessary, I've seen in the hospitals where we add additional protection for those whose kidneys are actually a little more frail and need a little bit more assistance. So this big slide right here, all in all, is just letting us know that it's important for us to watch what we eat while we're have PCOS. You want to stay away from, on the left are all the bad stuff, like the sweetened juice, sweetened applesauce, starchy vegetables like potatoes, the white grains like rice, flour, and then all the nice sugary cereals like Frosted Flakes that I grew up with. And replace them with things like fresh fruit. You can even have them frozen or canned as long as it doesn't have any additional sugar. Alternatives for starchy potatoes and such are broccoli, spinach, and carrots, and we can go towards more whole grains. We also like to look towards fiber cereals like kashi, because having the higher fiber in our diet helps slow down the absorption and keeps you fuller longer. In addition, this is just continuing on what I was saying earlier, just sodas, cookies, candies, chips, all the pretty much the nice processed things that we all have and take on the go. As much as it's really nice for our lifestyle, we actually want to go ahead and try to make that lifestyle change to more natural things. In addition to the foods, it's really nice to also learn how to read the nutrition labels. We typically look at them just briefly. One of the things that I notice when I see nutrition labels is that we don't pay attention to the serving size, and that can throw a lot of people off. So learning how to read nutrition labels can be a presentation all on its own, but I won't go over that today. And as I was mentioning earlier, the high fiber carbohydrates can help you keep you fuller. So that's why oatmeal in the morning can keep you a lot more full than taking like Frosted Flakes in the morning. Other than high fiber meals, you can also combine your carbohydrates with a protein or a fat, which can also help slow down the absorption rate of all the sugars and keep your insulin levels low so that you have a nice steady level and it doesn't spike and you don't end up getting that like food coma that we most commonly see after eating like really heavy meals. Things we can also do is to learn how to portion control our food. Before I used to actually try Weight Watchers, and one of the things that I actually took from that when learning is actually how to portion control and try to measure things out. I know that it can be very hard for us who are on the go to bring out our little scales and our little measuring cups and measuring spoons. But if you Google something like that to portion control, it helps. And even just our plate sizes can actually fool us. So I've actually gone down personally for myself from the normal size plates that come in the dinette set to actually the small little cube plates to actually eat my meals. And also to go along with the meals is we're normally taught to eat the 3 square meals a day, a nice way, and with that it can actually surge your insulin levels, your glucose levels, and everything like that. So it's very nice to kind of graze all day, eat small meals very frequently. It feels weird at first because you're always hungry, but you're actually keeping your body constantly working at it rather than stop and go type of thing. I was thinking about it earlier, and I actually thought about it to explain that is like, imagine that you're driving to work and you're driving down 880 and you're going down for the AM traffic commute, the lunch commute, and your home commute. Those 3 times of the day is when it can get blocked pretty easy and you get frustrated and you get tired on the road. So if you actually kind of go around those and keep going at the off commute hours, you can actually get home a whole lot faster. Other than nutrition and trying to learn how to eat right, exercising helps very well, not only just by helping you use the energy, but it also makes you feel good at the end. It always is a really hard start to try to exercise at the beginning. But what I've realized is I'd rather exercise first and then actually learn how to do the eating. There's so many good foods out there that I feel like at least if I can adopt this, it makes it a little bit easier. One of the things that we like are stretching, so somewhat like yoga. It also keeps us flexible, relaxed, and it can help prevent from injuries. I know when we see like little kids going around, they almost look like little contortionists, and as we get older, we start to have all the aches and pains and can't move anywhere, can't bend down to pick up a pencil and things like that, so we have the kids pick them up. But stretching has been really effective at keeping us limber and being able to get stuff. Another exercise is via toning through weight training. Most women, they try to stay away from the weight training because they're so nervous about getting muscles and looking like the Incredible Hulk and stuff like that. But in all honesty, it just helps keep what muscles you do have there. It helps tone you up. It also helps with our bones. As women, we tend to get osteoporosis as well. So being able to tone as well with the weights can help us in other ways as well. A good thing also about being able to weight train is that it helps boost our metabolism. I've noticed that the tendency is I'll actually eat a little bit more, but I won't really gain so much, or my choices will be a whole lot smarter after the gym because you've learned to work out really well. You don't want to just waste it by going out and getting cookies and candy. You tend to think a little bit about it. And finally, most women, I'll see them on the treadmills, the elliptical machines, running around. That's great. But combined with the muscle toning can help even more so. Cardio is really great for us because, yes, it does help us lose the fat, but it also helps keep our hearts healthy, keeps us running, keeps us beating, going around. I noticed on the treadmills that we think we have to run really fast in order to be able to lose all the weight. In all actuality, with burning fat, it's actually at a lower speed, but you just got to do it for the longer time. For exercise, my friend was asking me actually how long should she do things like this, and I mean everyone you hear usually says about for 30 minutes about 3 times a week. But if you're just starting out, it's what works for you, what's comfortable for you. A lot of people are used to being able to staying at desk jobs and sitting around. So even just getting up and walking around, getting up, taking the stairs, it doesn't have to be anything worldly out there. It's just small little things that we do can actually help us in the long run. Long-term risks of having PCOS, especially if it's gone untreated, is, as I've been mentioning throughout my presentation, is the development of type 2 diabetes, and as well as the development of cardiovascular disease. Other risks that can be out there is stress and anxiety, embarrassment, infertility, depression. These are things that, especially for our family members who are on the younger side, alongside dealing with the normal pressures of just being a teenager or a young woman trying to grow up in this world, that stress level can really affect their hormones and them trying to develop as women. Here, we are very fortunate here at Washington Hospital that we have our outpatient diabetes center. You could go to the website. It's available Monday to, the website's all the time. And going to the outpatient center is on Mondays to Fridays at 8:30 until 5. And that's about it. Thank you very much.